My first interaction with occupational therapy came about when Isaiah was 10 months old. I met up with Sarah Stevens, an occupational therapist who eventually became my co-founder of CKFTO. That was when I became aware of the significance of the role of a team of professionals in helping to manage children with disabilities. So today, we're going to visit an occupational therapist to help parents understand the role of OT in disabilities.
Action.
Okay, Daddy. A classic example of a physical disability is somebody who is in a wheelchair.
Okay.
Today we'll be chatting with Aaliyah Drakes, who runs the Opal Kids Pediatric Occupational Therapy Clinic, aptly named after her grandmother, Opal. Aaliyah has written articles for a very special disabilities forums page about occupational therapy, and she has also shared her love for her career and her patients during the Foot Soldier series. This year, Aaliyah will be celebrating her 10th anniversary as an occupational therapist, and so it is our honor and our pleasure to have her here today chatting with us about occupational therapy so that parents can have a better understanding about OT and how it works in their kids' lives. So please help me in giving a warm cause and effect welcome to Aaliyah Drakes from the Opal Kids Occupational Therapy Clinic. Aaliyah, welcome.
Thank you, Laura. Thanks for having me and thanks for being here today.
All right. So, Aaliyah, I want to cover a few things. The first thing is, and I'll precede my question by saying, when parents get this diagnosis that something is going on with their kids, sometimes you get a little bit scared. And one of the first places that we are sometimes sent to is the occupational therapist. And because nobody usually knows what an occupational therapist is, we feel scared. So can you help parents to understand exactly what occupational therapy is about?
Yes. Well, as occupational therapists, we see an occupation to be anything that's meaningful to someone. So the occupational therapist helps all ages, not just children, but we work with all ages for anybody who has either a disability, an illness, a condition that prevents them from doing everything they need to do in their daily lives. It can be either a physical condition, or it can even be a mental one like depression or schizophrenia or those hidden disabilities that we often hear about and don't see. And we just work with the person who has any limitation, find out what the limitation is, and figure out what's the best way to help them be as independent as possible in their different environments.
All right. So if a parent has to see you, because we are really specifically dealing, I know it's across the spectrum, I know it's, you may treat a stroke patient, you may treat an elderly person, yes?
Yes.
Okay. You may treat a child with a disability, various disabilities, right? All right. So if someone has to see an occupational therapist for any reason, where is the first place they should go to get a referral to an OT?
Well, for children in particular, they should go to their pediatrician first because the pediatrician will rule out maybe any medical issues. The pediatrician might be able to give a diagnosis if there is one. And the pediatrician will also be able to guide them correctly as to the persons they have to go see, rather than them going all over the place and, starting with a whole bunch of different therapists and not really having a clear idea of where to go. So they should go to the pediatrician first or a doctor. They can be self-referred. They can just call us up if the parent notices maybe the child is not developing as they think they should. They can call up an occupational therapist to get more information and to make an appointment, but it's advisable to go to the doctor first.
All right, Aaliyah, can you give us an idea of some of the behavioral issues that children may display that may cause or should cause parents to become concerned and visit either the pediatrician or the OT?
Okay, so for young children, you want to look at things like making eye contact, playing, looking at you. If it's on the physical side, you might want to look at if they're sitting up at a certain age, 5 months. If they're not sitting up, you might want to check that out. If they're able to hold the bottle, if they might be, picking up little pieces of food to put it to their mouths. You want to also look at how they're playing with toys. If they are just taking the toy and maybe spinning the wheels, or if they're, driving the car. And basically anything that you feel, if you feel there's a delay in anything, or if you feel that anything is not going as you think it should, you should go and just ask your doctor, ask your pediatrician about it, because they will be able to let you know and maybe either ease your fears or put you in the right direction.
Join us for episode 2, where we will discuss occupational therapy from assessment to actual therapy and how to go about choosing a registered OT. See you soon.